I think what's important is to, again, bring the temperature down for a second and give Americans accurate information about what the policies would really do, and then allow them to vote on that on their own, right? Instead of trying to sway them in one direction or another. Americans know that healthcare is broken in this country. I think that, there's a lot of, on both sides, certainly. I mean, corporate Democrats and corporate media like MSNBC, they hate Medicare for all. I mean, they've been tearing it down from the beginning. Same with CNN. The question that we heard over and over again when Bernie Sanders was running and promoting Medicare for all was, how are you going to pay for it? How are you going to pay for it? How are you going to pay for it? Okay, great. They don't ask the same question when it comes to shelling out tens of billions of dollars for a war effort in Ukraine. There is no debate about it. Now, look, I happen to think it's important to help Ukraine defend itself because we made security commitments after Ukraine gave up its nuclear weapons. We were part of those negotiations. I think it's important to keep our promises. But with that said, it is interesting how the corporate media puts its thumb on the scale. They pretend like, oh my God, this is the most costly thing in the world. How are we going to pay for it? But when it comes to other issues, like issues that would enrich defense contractors, there is no conversation about how we're going to pay for it. That's a problem.
I mean, I totally agree that we should always have the conversation about how we're going to pay for it. And I also agree that what is happening in Ukraine, it may be an unpopular position on some parts of the right, but I've been an advocate of funding Ukraine. It seems like the single best defense investment that the United States has made in the recent past. For a relatively cheap cost, we've absolutely crippled the Russian military, which is something I think is probably a good thing, globally speaking. With that said, there obviously is a difference in scale between the amount of money that we're spending in Ukraine and the amount of money that would take to do Medicare for all.
Right.
And there are obviously significant drawbacks to Medicare. I mean, if you look at the NHS, for example, there's a recent article in the New York Times talking about the delays in, for example, ambulances, people waiting 12, 24 hours, literally on a field, not being able to get what they need, because once you make systems national, you're going to have to in some way ration the resources. And then the question becomes, what are the resources? Either you have to increase the resources that you're utilizing, which means increasing taxes or increasing regulations, or you have to regulate the amount of care that people can receive on the other end. Well, my personal experience with sort of a Medicare for all system is in Israel, their emergency care is very good. And if you have cancer, you are in serious trouble. And this happens to be what the statistics kind of bear out. The United States has the highest 5-year survival rate for things like breast cancer. If you have a serious disease, people are coming to the United States for surgery, for treatment. If you have a broken arm, you're probably better off in a nationalized healthcare system because it's fairly simple thing to solve, and it's not going to cost you, quote unquote, anything except indirectly.
But I think it's really important to differentiate the quality of care that is available in the United States, which I agree with you is fantastic if you can afford it. And when it comes to your life, or when it comes to a family member's life, let's say you don't have the money up front to pay for the procedures or the treatment that you need, right? People are willing to go into debt because at the end of the day, it's about your life. And I am tired of seeing elderly individuals, retired individuals in this country lose everything, go bankrupt because of how broken our healthcare system is. It needs to be fixed. So on one hand, I agree with you. The quality of care is certainly here. It's where people come to get the treatment they need. But in a lot of cases, Americans go bankrupt for this. I'll give you an example. My mom was diagnosed with she'll be okay with me sharing this because I've talked about it on the show before. She was diagnosed with blood cancer last year.
I'm sorry to hear that.
Yeah, and it was really difficult because her bone marrow stopped producing hemoglobin, and we didn't know what was wrong with her before she got diagnosed. She was just very, very weak. She had no color at all. It was terrifying. She had to keep going in to get blood transfusions. Finally, they diagnosed her, and they said, look, the good news is there is a medication. You can be on this medication for the rest of your life. It's a chemotherapy medication. It's called Revlimid, but it's monopolized. And even though Revlimid was discovered decades ago, and I think the 1950s, if I'm not mistaken, the way patent law works with pharmaceutical drugs, I mean, they've found loopholes and they were able to extend the patent, extend it. So there's only one option. And even with insurance, I mean, my mom's older, you know, she's covered and everything. Even with insurance, it's $2,500 out of pocket. And, you know, I'll do anything to keep my mom alive. You know, we'll contribute to it. Luckily, you know, they found a solution. She's doing great. But if you don't have the privileges that my family has, if you don't have family members who are making enough money to contribute to help pay for that medication, you are screwed. You're either going to go bankrupt or you're just going to decide, I'm not going to get the medication and I'm just going to end my life that way.
Right.
And I don't want Americans suffering from that. So we need to find a better solution. And so far, from what I've noticed in different models in other countries, that single payer solution seems to be the best option.
Right. So I would obviously argue that you have to take into account a few different things in a situation like that. One is the cost of development of drugs. Virtually all medical patents happen in the United States, specifically because it is a free market system.
We fund the research and development, though.
Well, I mean, we do, but it's not even close to what the actual medical companies spend on research and development. What the federal government spends on R&D for medical product is so much lower than what Pfizer spends on R&D. And it takes forever for, I mean, the vast majority of these things are washouts. Hundreds of billions of dollars will be spent on drugs.
For pharmaceutical companies?
By pharmaceutical companies that don't go to phase 3.
I mean, they certainly provide quite a bit to their shareholders. So.
Well, I mean, it depends on which ones. You're looking at the ones that actually succeed. I mean, for every pharmaceutical company that succeeds and actually becomes a thing, there are a dozen that fail. I mean, this is just the way that biopharmaceuticals work. I was talking with my friend Vivek Ramaswamy, who founded Roivant Sciences, and this is literally how you used to invest. The idea was that you invest in a bevy of drugs, like a basket, and the vast majority of them will die before phase 3, and a few of them will be successful. How do you make up all the money to pay for all the ones that fail in order to pay for the one that succeeds? So how do you continue to incentivize it? So I think that the questions that we ask are the same questions. The solutions are different. So how do we continue to incentivize the creation of drugs that can help your mom? 2, how do we help your mom pay for the drugs once she gets sick without destroying the incentive? 3, how do we actually incentivize doctors to care for your mom with, say, Medicare reimbursement rates that aren't significantly lower than what they can get cash out of pocket, which very often you're seeing doctors in specialized fields just stop taking Medicare entirely because they're operating now across the table. They'll just say, we'll take cash only. This happens in the surgical profession a lot.
Right.
And so there are, I think, systems that are in between what we have and single-payer healthcare that have been significantly more efficient in this respect. Switzerland is one of them. Singapore is another one of them. My argument isn't with restructuring the system. It's how we restructure the system. And, the simplicity of the NHS comes with significant downstream effect, which is...
The one other thing I'll say is, okay, so just quickly on the pharmaceutical drugs. I mean, you will admit, though, right, that when you look at the amount of money Americans are charged for pharmaceutical drugs relative to any other country, we're being price gouged.
Well, we are subsidizing the rest of the world in their price gouging is how I put it.
I mean...
The reason I say that is because we are paying free market prices and they are paying cartelizes. They've cartelized their pricing structure. And so we could, theoretically, bargain negotiate with the drug companies, and then all the patents will get filed elsewhere. That is the other downside.
In the very least, I mean, one of the proposed policy solutions in Build Back Better that was nixed was allowing for Medicare to negotiate drug prices on behalf of Medicare recipients.
Right.
That was squashed. I mean, not entirely. I think there's like a handful of drugs.
No, it's for this reason. It's because the great fear in terms of the incentive structure was, if you allow Medicare, which supports a huge percentage of people who are taking these drugs, to negotiate the price, what you're going to do is remove essentially the R&D budgets of a lot of these companies.